Hi everyone, today we're doing a lifting thread treatment. So starting off, we are marking the patient up with her sitting completely straight up, just allowing gravity to do its thing, and really appreciate what we're doing with these threads and where we want to relocate this tissue. So you can kind of see I'm just assessing where I'm pulling and seeing if I like my entry point. And you can do multiple entry points, which we do end up doing here, just because I felt like I got a little bit of a better pull for the jowl area with a slightly higher injection point. So never be afraid to do multiple, areas of entry. Every patient is going to be a little bit different. So here I am just continuing to mark up. I like to go ahead and do my jawline as well. Sometimes once we go through and do our 3-vector lift or however many threads we're placing there, it does change where I want to place my jawline. But just for the sake of marking up, I do go ahead and do that initial line as well. So here I have some lidocaine with epi, so I am just going ahead and numbing my insertion sites. This is this patient's first time getting threads, so as I'm going through my treatment, I kind of like to talk to my patients and just describe what I'm doing so they're prepared. One thing I will say is I do have patients watch videos prior to coming in, and one thing they always say is that it was not as bad as it looks. So watching these videos, it can look very scary, but overall this is a pretty comfortable treatment as long as you're in the correct plane. I like to describe it, it's kind of like a creepy, crawly sensation. It's not really painful as you're going through that plane with your thread. It's just more of an odd sensation that you've probably never felt before. And that's what I'm doing right here with my cannula. So as long as we're in that smaz layer, it really should be relatively comfortable. For this patient in particular, I decided to stop before the nasolabial fold. Just keep in mind when you're placing threads, you never want to stop in an area of animation. So never have the end of your thread end right in that nasolabial fold or right in that marionette. When the patient smiles, you will be able to see the end, or there's a greater possibility of being able to see that thread. So just keep that in mind. But here I'm going through with 1% lidocaine mixed with a little bit of sodium bicarb, just to take a little bit of that edge off of the burn. Really, the lidocaine burn is the worst part of this treatment. So the sodium bicarb helps out in that aspect. I just do a 1-to-1 dilution with that. But now we're going in with our threads. This is an 18 gauge, 18 by 100 thread from VSoft Lift. So we are going to be using 18 gauge for each one of our vectors here. The threads come in multiple different sizes. Depending on the gauge is going to determine the thickness of the thread. So the 18 gauge is kind of right in the middle. It's not the thickest thread that's available, but we went ahead and chose this for her today. I do like to keep some gauze over top of the hair. It was moving out of the way a little bit, but as long as you're not starting back in that hairline and you're using good technique when you're prepping that patient. I like to HIPAA cleanse as well as alcohol prior to treatment. So just make sure you're keeping that hair out of the way. Now we're going down for our marionette line. I do a really nice firm pull as I'm lifting. We want to be pulling that tissue where we want to see it after placement, if that makes sense. So you really want to make sure you're pulling that tissue up so it can hook on to those barbs and give the best lift possible. It looks like I'm, causing discomfort, but I'm really not. Just some light pressure and really just elevating up that tissue. Same thing here. I just kind of drag that tissue and feel those barbs engage underneath. Now I'm going in with just one more to her jowl area. This was her area of concern, so I'm placing 2 threads to this area just to get the best lift possible. I always see my patients back in about 2 to 3 weeks, just depending on their result immediately after, like how swollen they are. Typically around 3 weeks, I want complete healing, especially if the patient is planning on doing a little bit of filler as well. I want them to be completely healed. So now we're just going through and snipping the ends of those threads. You want to make sure you're as close as possible, and they'll just pop right into your entry point. I believe we do have this patient sit up, and we do a side-by-side or something at the end just so you can see that lift. but I like to make sure I do a nice smooth. The barbs on the threads are bi-directional. So I kind of use my thumbs to press both directions just to make sure everything is fully engaged. Now we're going along and doing her jawline. I went ahead and just wiped that initial mark off because my line did change a little bit just from my initial lift. You can already appreciate that lift right in her jowl area, and it's going to look even better once she's sitting up straight. But we're just going back and doing that same exact process. So going back in with my cannula, this is a 22 gauge 75 millimeter cannula with 1% Lido and the sodium bicarb. So same thing that we used for her initial threads here. Sometimes it can be a little bit pinchy by the mouth, so I just warn my patients. And sometimes their lower lip can feel a little numb as well, just because we're right by that foramen in near the lower lip. So I always just kind of warn my patient of that. But now I'm just going in with my last thread here. If the patient is going to need more threads, we do determine that once they're completely healed. So like I said, at that follow-up appointment, we will see if she wants to do any more and just make sure everything is symmetrical. Overall, this treatment takes about 30 to 45 minutes, just depending on how many threads we're doing. But here we're just gonna go ahead and place our Band-Aids. I have my patients keep these on until the end of the day. But here is a nice side-by-side. You can really appreciate, especially in the nasolabial fold and along that jawline. Even from just looking at her now, I do think I'm going to want to do maybe 1 or 2 more in her nasolabial fold, but we'll go ahead and determine that at her follow-up.